It's time for our Wellness Wednesday. More than 1 million sexually transmitted infections, or STIs, are acquired every day worldwide, the majority of which are asymptomatic. To talk more about this subject, we have Dr. Janice Coffin with AU medical students Dr. Sarah Atari and Dr. Bailey Rogers joining us this morning.
Ladies, good morning.
Good morning. Good morning.
All right, we're talking about an important topic that, it needs to be talked about. Tell us first, what are STIs?
So STIs are infections that are spread from person to person through intimate contact. They can affect people of all ages, genders, and orientations. And a couple examples of these infections are things such as gonorrhea, chlamydia, trichomonas, HIV, herpes simplex virus, and human papillomavirus.
And this might sound like a silly question, sort of, but why should we be worried about STIs? I mean, how bad are they for our health?
Yeah, so we worry about STIs because of the long-term health complications they can have. So a couple examples of this is HIV can go on to develop into acquired immunodeficiency syndrome, also known as AIDS. Human papillomavirus can go on to develop into cervical cancer. Gonorrhea and chlamydia, if left untreated, can go on to develop into pelvic inflammatory disease. And syphilis can affect our brain, our hearing, our vision, and it can even be passed from a mother to her baby and cause long-term health complications in the child as well.
Oh, that's just scary. No one wants that to happen.
I don't like any of that.
An important question, Dr. Bailey, how would someone know if they do have an STI?
So as you said, actually, the majority of STIs are asymptomatic, so many people don't even know that they have them. The best way to know if you have an STI is to have open and honest conversations with your healthcare provider. I think sometimes we can feel a little bit shy or think that these subjects are awkward or taboo, but if you speak with your healthcare provider about getting tested, you can have more information to arm yourself and protect your health. Now, there are some symptoms that you can look out for. So symptoms would be pain, abnormal discharge, or bleeding in your intimate areas, any sores on the skin, pain with urination, or even a flu-like illness can be a symptom as well.
Okay, so what are some prevention methods, some treatments, if you have it?
So as I said, having open and honest conversations with your healthcare provider and getting tested frequently is a great way to prevent any long-term health complications. Additionally, using barrier methods such as a condom can prevent transmission of these infections from one person to another. Now for HPV specifically, there is an HPV vaccine for adolescents and adults, and then for females as well to keep up with their pap smears. Now treatment, that depends on the type of infection. So bacterial infections such as gonorrhea, chlamydia, syphilis, those will be treated with antibiotics versus viral infections such as HIV or herpes simplex, those will be treated with antivirals.
Good to know right there. And you said a lot of these are asymptomatic. So the best thing to do is if you are sexually active, just get tested as a precaution.
Right.
Dr. Coffin, where can people go for more information?
Yeah, no, so this is a subject, again, that some people just don't like to talk about. It has been taboo, but they do state about 20% of all Americans will have a sexually transmitted infection. So again, either if you're having symptoms or even if you're asymptomatic, especially for men and women, when you go in for your yearly or annual preventative visit, ask about those things. Ask if you can get tested because it's easily to test for. The other thing is some of you may not have a primary care provider. The local health departments, the Richmond County Health Department, the Columbia County Health Department, they can also do testing. So if you don't have a primary care provider, go to the local health department. If you're symptomatic, please go get tested and or treated. And again, if you do test positive, let your partners know. A great way to find more information is always the CDC or the Centers for Disease Control. You can look that up. You can look up symptoms to see, do I have a sexually transmitted infection? And it kind of tells you what to do. But again, talking about it, seeking help for those things is always best to do.
Okay, good information. Thank you, ladies, so much for coming on and talking about this.
Thanks very much.
Yes,
Thank you
so
for having
much.
us.